Hi there, I am Dr. Susie Houston. I am a nurse practitioner at the ECU Health Lifestyle Medicine Clinic in Greenville, North Carolina. And this is our Diabetes Meets Lifestyle Medicine May check in. So we are well into May, May 8th today. So, whoo, time's a flying. And this is just a little check in on diabetes, lifestyle medicine, and things that you may be doing already, or maybe have been thinking about, or might be some new ideas on helping to manage, prevent, or delay diabetes. So I am a doctor of nursing practice for with adult gerontology nurse practitioner certificate. I'm a certified diabetes care and education specialist, and I've been helping people with diabetes in Eastern North Carolina for more than 18 years now. Again, time flies really quickly. My position for the last year and a half as a nurse practitioner at the Lifestyle Medicine Clinic has been very rewarding because I get to help people make changes to what they are doing already in the areas of healthy eating, being active, managing their stress, um, sleeping better, developing relationships that improve our health and wellness, and also avoiding risky substances. And all of those six that I just mentioned are pillars to lifestyle medicine that can help people manage chronic conditions like diabetes type 1, type 2. Type 2 especially, we can prevent it, so it's making sure that we are able to help people where they're at so that they know what they might be able to do just a little bit differently. Now, the American Diabetes Care and Education Specialists, or the association, they also have 7 self care behaviors to help people manage diabetes. And in most cases, a lot of people don't even have that diabetes education to help do the best that they can do in their own home environment. And those are things like healthy coping, problem solving, risk reductions, monitoring, taking medications, being active, and of course healthy eating. That always kind of comes around to, oh, what do we get to eat, or what are we going to eat tonight, or what are we having for our birthday celebrations, or any celebrations in general. With May, I know the April showers were bringing the May flowers, but hopefully people are also getting vegetables out into their garden, or herbs, and just changing the landscape of what they're doing in their own backyard, or making sure that they're tapping into resources at the farmers markets that start to pop up, and using those to make wise choices of produce, fruits, and veggies that are close to home. I'm thinking of the strawberries that are over near, there's a farmer's market close to, I live in Bethel. And so that's kind of nice to have that in your area. And you know that those strawberries haven't traveled very far. So those are important. So if you get out, make sure, try not to eat all of the strawberries at one time. Maybe think about if you get a bumper crop that you maybe freeze some so you'll have nice fresh strawberries in the winter months. With May, I usually talk about the Sparks People calendar. Now you can do a search on that and find out. For May, we've got 31 days to stronger bones. Bone health is really important, and May is the National Osteoporosis Awareness and Prevention Month. So it's time to remember the importance of preventing osteoporosis. That's where bones become brittle and weak, and then we're at more risk for fractures without even doing anything, but maybe standing up to go for a walk. So that's important that we take good care of our bones. And for today, May 8th, it's got a little message for each day to help. And today it's saying drink milk. Dairy products are the best source of calcium. Just 1 cup of milk or yogurt has 300 milligrams of calcium. So try to get 3 servings in so that you could get your day's worth of calcium. Now, not everybody can drink dairy, and mainly the cows like the milk. But for those of us that are lactose intolerant, you might want to think about some other foods that are high in calcium. You might need to eat a little bit more than a cup, but you can check those out. And these are things like figs, kale, soybeans, bok choy. I like this because collards, mustard greens, those kind of things are grown in eastern North Carolina. Broccoli, oranges, seeds like poppy seeds, pumpkin seeds, sesame seeds, chia seeds, and those are all great things to throw into your oatmeal to bump up the fiber. If you know me, I love the F word, and that's fiber, and we need 25 to 30 grams of fiber a day. But now you can get some extra calcium put in when you add those into your plan. So that's really important. And then just be thinking of what's available April, May. We've got asparagus, broccoli, all those greens that I just talked about that are high in calcium. We've got sweet potatoes, but I think I see sweet potatoes year round in eastern North Carolina. I think they have a great shelf life as long as they're kept in a cool, dry place. Also, romaine might be growing in some gardens. And I just noticed the seeds I planted last month, my radishes are starting to pop up. So that's nice. And then always herbs add to flavors of all sorts of things. Now, I just wanted to mention in respects to fruits and veggies and foods for May, on May 16th, we'll be having a cooking demonstration, and it's from 3 to 4 o'clock. And if you needed more information, you could call our main line, and that's 252, excuse me, 847-9908 to find out the details and to see if you're eligible to stop by for that program. Also, excuse me, I wanted to mention that May 10th, which is coming up, is World Lupus Day. And this is a sneaky condition that it impacts at least one estimated 1.5 million people in America, and 90% of the people are women, and then 15% are children under like are diagnosed with lupus. But it can affect any body part. And so when people that live with lupus, they struggle, and you can't tell if somebody has lupus or not, just like you can't tell if somebody has diabetes or not, or high blood pressure. We can guess, but World Lupus Day is May 10th. So if you know somebody with diabetes, put on your purple to show support. Purple's the color. But the things that can happen with lupus, it can impact joints and muscle pain, hair loss, lung damage, kidney problems, heart complications, miscarriages, brain involvement, rashes, mouth and nasal ulcers, and debilitating fatigue. So it's quite a wide range of symptoms, and sometimes people go undiagnosed for years. So just be thinking of that if you know anyone that has any symptoms like that that seem kind of sort of vague, and maybe they need to get checked out to see if what they've been dealing with might be lupus. Also, May 6th to May 12th is National Nurses Week. So if you know a nurse, please reach out and thank them and show your gratitude for all the hard work that they do. Nurses have an important job and they are super busy, but we are so glad that they're there to help us throughout hospital stays, office visits, and even phone calls to check in on us if we've just left the hospital. May is Better Sleep Month, so just be thinking, how could you get a better night's sleep? And that's also one of our pillars of health for lifestyle medicine. So, a couple of things for sleep health. It's avoid going to bed and getting up at different times. Especially sometimes we have our weekday work day time to go to bed, and then weekend we are acting wild and crazy, and so we might be going to bed later, getting up later. Really throws us off our cycle of healthy, good, valuable sleep that we get, and that's important. Restrict certain drinks before 1 hour before you go to bed, like well, nicotine is in there, caffeine and alcohol, because they can throw off your sleep. And then avoid intensive exercise 1 hour before you go to sleep. Sometimes people worry before as their head hits the pillow, and so they might have to take a personal journal and write their thoughts down, and that might help. Be physically active each day so that that is almost like your medication to help you be tired by the end of the day. If you lounge around all day and then you're getting ready for bed to do the same thing, your body might just be underexerted, I suppose, and then just might not want to sleep because you've been resting all day. Avoid long naps. Power nap is considered less than 15 minutes. Avoid games and social media or networking before you go to bed. And try to eliminate the light from the room and the noise from your room and even the temperature. Some of us need certain temperatures to be at our best. So, May is known for Better Sleep Month. So work on that as best you can. Also, be thinking about May as National High Blood Pressure Month. And one out of three people with high blood pressure, there's one out of three people with high blood pressure and they don't even know it. So it's a sneaky condition. It reminds me like diabetes. People don't really feel that they've got high blood sugars unless it's significantly high. And that's the same with blood pressure, unless it's significantly high and maybe causing a headache or change in their vision because of the headache. But high blood pressure makes your heart work too hard and increases your risk of heart disease and stroke. So it's really important to know your numbers. The so-called normal, or where our heart should be working, is 120 over 80. And then we get pre high blood pressure. So um, those numbers could be anywhere from like one below 140 and the bottom number below 90. And then the high blood pressure is considered above 140 for the systolic, which is the top number, and above 90, which is the bottom number. And these are important that when you go to get your blood pressure checked at your provider visit, that you ask what your numbers are, so that then you can be in the know. Everybody should be in their know about their numbers, and that's really important. So know your numbers is one thing, and then doing something about it. So if you know you have high blood pressure or you have family history of high blood pressure, then you might want to be thinking about avoiding salty foods, or adding extra salt, or prepackaged foods, or fast foods, because they can be high in fat, high in sodium. Also, alcohol can make blood pressure go up. Smoking can make blood pressure go up. Caffeine. Keep a track. If you do have high blood pressure, make sure you keep a track of your blood pressure so that when you go to see your provider, you can share that, oh, yeah, these things are happening throughout the time between visits, and my numbers are looking quite decent. Think about a healthy eating plan, exercise plan, and that tracking at home, because sometimes people have that white coat syndrome, and it may just be that they need to work on their numbers at home to make sure they're not staying high even when they're in the comforts of their own home. And I like this idea that according to the American Heart Association, owning a dog may protect you from heart disease. So I'm not saying if you're a cat person, not a dog person, I'm not saying you must have a dog, but if you were ever thinking about it, the Humane Society might have a little furry buddy for you. And imagine having a puppy dog, or a senior dog, any age dog, and that might be the one that helps. Some people use pet therapy, or they have like an emotional attachment to their furry families, and that might be a helper to bring blood pressure down. So look into that. Now, when you think about ECU Health Lifestyle Medicine Clinic, it's diabetes and prediabetes that I usually talk about, because I want people to stop, prevent, or delay diabetes, but I also love to help people stop, delay, or prevent high blood pressure. So for either one of those chronic conditions, diabetes or high blood pressure, think about the concepts of food as medicine, exercise as medicine, and that how we eat and what we do can impact our mood, our weight, our blood pressure, our glucose or sugar, even our cholesterol, joint pain. And when you think of lifestyle medicine, what great medication with very limited side effects, and no copay. So think about maybe meeting one on one with one of our providers. Maybe it's a nutrition visit you need, maybe a counselor, or maybe coaching. And then also, if you were interested in our cooking classes, please give our clinic a call to find out what's available, what's coming up, so that we can have you on our list when we're ready to reach out and when we've got a new program coming up. Okay. With the pre-diabetes, it's making sure make sure if you've had an A1C checked in the last year, the last half a year, try to remember what the number was, or call and find out, or ask next time you go to see your provider. If it's below 5.7, that's in the normal range, so that's great. If it's between 5.7 and 6.4%, that's pre-diabetes category. This should be a time where you've heard me maybe mention these numbers, that you stop for a second and find out from your provider what should be your next steps. And you can always reach out to our clinic to find out what classes are available for diabetes prevention. You can even go to Diabetes Free NC, and I want to say it is diabetesfreenc.com. to find out. You are at risk, or you're eligible for these programs if you have 5 or above on the prediabetes risk test. You've had gestational diabetes, which means you were told you have diabetes while you were pregnant, or you had an elevated A1C, and that's that 5.7 to 6.4. If your A1C is 6.5 or above, that will put you in the diabetes category, and that should need further attention from you and your provider talking. Now, there's the prediabetes risk test, and think about it. If you are older than 40, 40 to 49, you get a point. So if you have 5 or more points after the end of these 7 questions, that puts you at prediabetes risk. And so 40 to 49 gets you a point, 50 to 59 gets you 2 points, and 60 plus years old gets you 3 points. If you're a gentleman, you get 1 point. If you're a lady, you get zero. If you were told you had gestational diabetes when you've been pregnant, you get a point. If you have a mother, father, sister, or brother with diabetes, that would be a point. And then if you've ever been diagnosed with high blood pressure, which ties into National High Blood Pressure Month, right? So if you've been diagnosed with high blood pressure or notice that your numbers are creeping up, that gets you a point. If you're physically active, you get 0 points. But if you're a bit of a couch potato, you get one. If you've been told you don't have to worry about your weight, you get 0 points. But if you've been told you're overweight, you would get a point. If you're very overweight, you would get 2 points. And if you've been told that you are in the obese category, you would get 3 points. So if you've got 5 points or above from the pre diabetes risk test that comes from the CDC, that puts you at risk for, if you do nothing as of today going forward, within 5 years, you could be developing type 2 diabetes and need some medicines. So think about ECU Health Lifestyle Medicine Clinic. We're here to help and offer you support to manage your health with the least amount of medicine and the most amount of lifestyle change. In teeny tiny steps. So, we have dietitians, we've got lifestyle coaches, we have exercises medicine program, we have cooking classes, and then we've got providers that can be helpful in addition to your primary care provider. And then lastly, we have a sweet talking chat, diabetes support chat, and we meet once a month. And excuse me, May 17th, we're going to be talking about improved sleep and stress less. Excuse me. So please come out. We meet 12 o'clock to 12:45 in our lifestyle medicine clinic classroom. And we're at 2610 Stantonsburg Road. If you have any questions, you can always call us at 252-847-9908. Want to make sure that we're all staying well hydrated. So make sure you are getting your daily uh, gallon of water in, or if you're on a fluid restriction, be careful. But all your drinks should be zero carbohydrate. So drink up whatever flavor water you like, lemon in your water, a slice of orange, a slice of cucumber, whatever works for you to get your fluids in. So until next time, I'm Dr. Susie Houston from ECU Health Lifestyle Medicine Clinic. Thanks so much for joining. Please contact us if you're interested in diabetes prevention, diabetes care, diabetes management, our lifestyle medicine services, or you might have found out you've got high blood pressure. We're here to help, okay? Thanks so much. Take care.